Hello guys, welcome to the ICD-10-PCS Coding Series. If you are new to the channel, subscribe and follow the playlist from the beginning so that you understand all the root operations thoroughly. I'm Vinay Kumar. I carry an overall experience of 20 years in the US healthcare industry with vast experience in medical coding, auditing, training, and mentoring. I have helped many professionals in gaining knowledge and preparing for medical coding certifications. I'm dual certified from both AHIMA and AAPC with extensive knowledge in all the verticals of the revenue cycle management. So at the end of this learning session, we will have a better understanding of coding the root operation insertion from the sixth group of root operations. We will also look at an example of coding from the medical and surgical section. And remember, medical and surgical section is the most important and the largest section in ICD-10 PCS. So as you all know, there are 31 root operations in the medical and surgical section, and these root operations are divided into 9 groups based on similar attributes of surgical procedures. Today, we are looking at the sixth group, which talks about root operations that always involve a device. So there are six root operations in this group: insertion, replacement, supplement, change, removal, and revision. If you observe carefully, all the six root operations talk about a specific device either being inserted, removed, replaced, or changed. So out of this, today we are looking at the root operation insertion, which carries a character value of h. Root operations are the most important aspect of building an ICD-10 PCS code. So remember, you have to always identify the objective or the goal of the procedure. That would define what root operation you would use for the procedure. Always read the definition of the root operation and compare it to the procedure performed so that you get it right every time. So, insertion. Insertion is defined as putting in a non biological appliance that monitors, assists, or performs or even prevents a physiological function but does not physically take the place of a body part. The root operation insertion represents those procedures where the sole objective is to put in a device without doing anything else to a body part. Procedures typically coded to insertion generally include putting in a vascular catheter or a pacemaker lead or a tissue expander. So, these are examples of procedures that are coded under the root operation insertion. Insertion of radioactive element or implant, insertion of central venous catheter, placement of a dual chamber pacemaker, placement of a bone growth stimulator. These are a few examples that are coded to insertion as the root operation. Let's look at an example. This is for the root operation insertion. The patient undergoes a placement of a dual chamber pacemaker for treatment of symptomatic sick sinus syndrome. So, an incision was made and a subcutaneous pocket in the chest wall area was created. The generator was placed in the subcutaneous pocket and the incision was closed. Both the right atrial and right ventricular leads were placed percutaneously. Okay, so basically, this uh, question is about placement of a pacemaker device. Okay, so a pacemaker device generally involves two parts to it. One is the battery or the pacemaker itself. The other one is the leads or the electrodes that are connected to the battery. Usually, the battery or the pacemaker unit, the pulse generator, is placed outside on the chest wall, and then from there the leads are inserted usually through a vein. Transvenous technique is what we call them. Okay, they puncture a vein and then through the vein they pass the leads all the way into the chambers of the heart. This is the most common technique, right? So you'll need to code for placement of the device, I mean the pacemaker unit or the battery, and also you need to code for the insertion of the leads separately. Okay, so that it would require three codes: one for the pacemaker or the battery, the second code is for the insertion of the right atrial lead in this case, and the third code is for the insertion of the right ventricular lead. So let's look at each of these codes separately. The first code. So the first code is for the insertion of the battery or the pacemaker. Section is medical and surgical. Body system is subcutaneous tissue and fascia. Root operation is insertion. Then the body part would be subcutaneous tissue and fascia of the chest. Approach is open because subcutaneous pocket was created by an incision. Then the sixth character would be dual chamber pacemaker for the device type. And the seventh character is Z, which is no qualifier. So the code for the insertion of the pacemaker unit or the battery is 0JH60 and Z. This is the first code for the pulse generator or the battery. Sorry. So the second code is for the insertion of the right atrial lead. Okay. Section is medical and surgical. Body system is heart and great vessels because the lead is placed inside the chambers of the heart. That's the reason we are picking up heart and great vessels as the body system value. The root operation is insertion for the third character. For the body part, we would code it as right atrium. Approach is percutaneous. Sixth character would be cardiac lead of a pacemaker. And the seventh character is Z, which is no qualifier. Now, this is the code for the placement of the right atrial lead. The third code is for the insertion of the lead into the left ventricle. It's a similar code like the right atrium, but then the body part is different. Okay, so the section is medical and surgical. Body system is heart and great vessels. Again, since the lead is placed inside the chamber of the heart, root operation is insertion. For the body part, we would code it as left ventricle L. Approach is percutaneous. Sixth character would be cardiac lead of a pacemaker. The seventh character is Z, which is no qualifier. So the code would be 02HK 3JZ for the right atrium and 02HL 3JZ for the left ventricle. So it depends on the body part value that you pick up, the fourth character changes. So the key points from this video: this group of root operations always involves a device that is inserted, removed, repaired, or replaced. But then a device is something which is always there. Okay, the device remains inside the patient's body after the procedure is completed. So any procedure that is done on a device is coded to this group of root operations. You will find the ICD-10 PCS coding manual, the tables and the index from this link. I have placed it in the description of the video as well. You can download it and use it for coding. Thank you guys. Thank you for watching. Please subscribe and support the channel. I hope these videos are helpful. I will be doing a lot of other videos as well, including CPT, ICD-10, CM, and a lot of other topics about US healthcare and medical billing and coding. Keep supporting the channel. Thank you so much.